Did you know that some of the medications people take every day could actually be hurting their brain? It's true. Many seniors rely on prescriptions to manage pain, sleep better, or deal with other health issues. But what if those very medications are quietly increasing the risk of memory loss, confusion, or even dementia? In today's video, we'll uncover the 5 common medications that science has linked to cognitive decline. If you or someone you love takes any of these, you need to hear this. Stick around to learn what they are, why they're dangerous, and what safer alternatives might be available. This could protect your memory and even save your independence. Anticholinergic medications, the silent memory killers. Anticholinergic medications are one of the most commonly prescribed drug categories for older adults, but they're also among the most dangerous when it comes to brain health. These drugs work by blocking a brain chemical called acetylcholine, which is essential for memory, learning, and muscle function. When this chemical is blocked over a long period, it can significantly affect how the brain processes information. Medications with anticholinergic effects include drugs for overactive bladder, allergies, depression, and even some used for Parkinson's disease. You may recognize names like diphenhydramine, which is found in Benadryl, or oxybutynin, a bladder medication. The issue is that these drugs don't just stop working after they relieve symptoms. They linger in the brain and interfere with how nerve cells talk to each other. Multiple studies have drawn a direct link between long-term use of anticholinergic medications and increased dementia risk. One major study published in JAMA Internal Medicine followed over 3,400 older adults for more than 7 years. The researchers found that those who had the highest exposure to strong anticholinergics had a 54% higher risk of developing dementia than those who didn't use them. What's even more concerning is that the dementia risk remained high even if the person had stopped using the medication years earlier. This shows that the damage might not be fully reversible. Another study out of the University of Washington confirmed these findings and even showed a dose-response relationship, meaning the more anticholinergics a person used, and the longer they used them, the greater their risk. Despite this, many seniors continue taking these medications without being told about the risks. Some may be using them daily for bladder issues, while others might be taking over-the-counter allergy drugs without realizing they're harming their brain. It's also important to note that these medications often appear under different brand names and purposes, so many people don't realize they fall into the anticholinergic category. This confusion makes it even more dangerous, especially for older adults who are already more sensitive to side effects and more vulnerable to memory problems. Thankfully, there are alternatives. For instance, instead of diphenhydramine for allergies, a safer option like loratadine may be used, which doesn't have the same strong anticholinergic effect. For bladder problems, behavioral therapies or medications with fewer cognitive side effects should be explored. But the first step is awareness, knowing which medications have these effects and bringing them up with a doctor. Most importantly, never stop any medication without speaking to your healthcare provider first. But do have that conversation. Bring a list of everything you're taking, including over-the-counter drugs, and ask specifically about cognitive side effects. Many doctors might not bring it up unless you do. Protecting your brain isn't just about crossword puzzles or eating leafy greens. It's also about looking at what you put into your body every single day. If a pill is silently chipping away at your memory, it's worth questioning whether you really need it. Prevention begins with knowledge. And knowing the risks tied to anticholinergic medications can be a powerful first step in safeguarding your brain. Benzodiazepines, the sleep and anxiety trap. Benzodiazepines are often given to older adults to help with anxiety, panic attacks, and trouble sleeping. Drugs in this category include familiar names like diazepam, also called Valium, alprazolam, which is known as Xanax, lorazepam, or Ativan, and clonazepam, also known as Klonopin. While these medications can provide short-term relief and help someone feel calm or sleep better for a few nights, they carry serious long-term risks, especially when it comes to memory, focus, and overall brain health. Seniors are especially vulnerable to the side effects of these medications, because the body breaks them down more slowly with age, and they tend to stay in the system longer. That means even a low dose can lead to bigger problems in older adults. Over time, Benzodiazepines can lead to a type of fogginess that many people don't notice until it becomes a major problem. This fog can cause forgetfulness, confusion, and slower thinking. Some seniors might even start to feel like they are losing themselves without realizing that the pill they take to sleep or calm down might be part of the problem. A landmark study published in the BMJ followed nearly 9,000 older adults and found that long-term use of benzodiazepines was linked to a significantly higher risk of Alzheimer's disease. Specifically, those who used the drugs for more than 6 months had up to a 51% greater risk of developing Alzheimer's compared to those who never used them. What's more, benzodiazepines can also cause physical dependence. That means your brain gets used to the drug, and when you stop taking it, you may feel withdrawal symptoms like increased anxiety, sleep problems, or even tremors and agitation. Because of this, many seniors stay on them longer than they should, not realizing that these medications were never meant for long-term use. The short-term comfort they bring often leads to long-term damage, especially to the brain. Falls and accidents are another serious concern with these drugs. They slow reaction time and make people more drowsy and off balance. In older adults, this can lead to falls that result in broken bones or hospital stays. But even without a fall, the drugs themselves can slowly damage how the brain functions. The sad part is that many people take them nightly without ever being warned about these risks. Doctors may prescribe benzodiazepines quickly because they seem to offer fast relief. A person says they're anxious or not sleeping, and the prescription pad comes out. But what starts as a short-term solution can become a long-term health issue. And it's not just prescription versions. Many sleep aids sold over the counter have similar effects or work in ways that impact the brain in the same dangerous way. If you or a loved one is taking a benzodiazepine, it's important to talk with a doctor about safer ways to manage anxiety or sleep problems. There are non-drug approaches like cognitive behavioral therapy, mindfulness techniques, and lifestyle changes that can work just as well in the long run without the risks to memory and mental clarity. For some people, switching to a different medication with fewer side effects may also be an option, but any changes should always be done under medical supervision to avoid withdrawal symptoms. The most important thing is to be aware. Don't just keep taking something because it's familiar. Ask questions. Look up the long-term risks. These drugs may seem helpful in the moment, but your future self may pay a heavy price. Brain health is about more than just avoiding disease. It's about protecting how you think, how you remember, and how you live day to day. For seniors, every choice counts, and choosing wisely when it comes to benzodiazepines can make all the difference. Antipsychotics. When side effects outweigh the benefits. Antipsychotic medications are usually used to treat serious mental illnesses like schizophrenia or bipolar disorder. But in recent years, they've also been prescribed to older adults for other issues, especially to manage behaviors related to dementia or severe agitation. Drugs in this group include risperidone, olanzapine, quetiapine, and haloperidol. While these medications can sometimes calm aggressive or confused behavior, they come with risks that are often overlooked, especially when used in seniors. One of the most troubling risks is how these drugs can damage brain function and increase the risk of faster cognitive decline, even in people who didn't start out with dementia. The goal may be to make life easier, but too often, these drugs end up silencing the person rather than helping them feel better or think more clearly. The brain is a delicate balance of chemicals that help us feel, think, and respond to the world around us. Antipsychotic medications interfere with this balance by blocking certain chemical signals, mainly dopamine, which is crucial for attention, motivation, and memory. While this may help in some severe cases, it can also slow down the brain in harmful ways. In older adults, especially those already dealing with memory issues or confusion, this disruption can lead to more rapid cognitive decline. Several studies have shown that people over 65 who take antipsychotics are more likely to experience worsening memory, slower thinking, and even permanent changes in brain function. One study published in the journal Neurology followed nearly 300 seniors and found that those taking antipsychotic medications experienced twice the rate of cognitive decline as those who weren't. Another huge concern is that these medications are often prescribed off-label. That means they're used for problems they weren't originally approved to treat, like agitation in dementia patients. The US Food and Drug Administration has even issued a black box warning, the strongest warning it can give, saying that antipsychotics can increase the risk of death in older adults with dementia. Despite that, many nursing homes and even hospitals continue to use them to manage difficult behaviors. The problem is, instead of looking for the cause of someone's agitation, such as pain, loneliness, or hunger, it becomes easier to give a pill that sedates them. Over time, this can lead to a loss of personality, reduced independence, and even early death. It's also important to understand the physical side effects. Antipsychotics can cause muscle stiffness, shaking, restlessness, and a high risk of falls. They can also raise blood sugar and cholesterol levels, increasing the risk of diabetes and heart problems. All of these things are especially dangerous in seniors who may already be dealing with other health conditions. What may start as a small dose to help with sleep or behavior can quickly turn into a serious health risk. Once someone starts on an antipsychotic, they may have a hard time coming off it, especially if there is no plan in place to monitor its effects or try alternatives. So what can be done? The first step is to ask questions. If you or someone you care for is taking an antipsychotic, ask the doctor why it was prescribed, what the goals are, and how long the treatment is expected to last. If the answer isn't clear, or if the behavior being treated could be managed in other ways, it's worth getting a second opinion. Non-drug approaches, such as music therapy, regular routines, exercise, or simply spending time with a familiar face, can often reduce agitation and confusion without the serious side effects. It may take more time and patience, but the benefits to brain health and quality of life are worth it. Remember, these medications have a place in treating severe mental illness, but they should not be the first option for managing behavior in seniors, especially those with dementia. The risk to brain health is simply too high. Our minds are what connect us to our memories, our loved ones, and our independence. Losing that connection to a pill that might not even be necessary is something no one should have to experience. Sleep aids and antihistamines. Nighttime relief with long-term risks. Many seniors struggle with sleep as they get older. Whether it's waking up frequently during the night, not being able to fall asleep, or feeling restless, sleep issues are extremely common in older adults. Because of this, many people turn to over-the-counter sleep aids to help them get through the night. These drugs are easy to find and often marketed as safe and gentle. But the reality is, many of these sleep aids contain antihistamines, especially diphenhydramine, which can quietly harm your brain over time. Antihistamines are meant to treat allergies, but they also have sedating effects, which is why they are added to sleep medications. However, what's often not clear to the people using them is that these drugs have strong anticholinergic effects, the same kind that interfere with brain chemicals important for memory and thinking. Diphenhydramine, which is the main ingredient in popular sleep aids like Tylenol PM, Advil PM, and even some allergy pills like Benadryl, blocks acetylcholine in the brain. This chemical is critical for memory, attention, and learning. When it gets blocked, especially night after night, the brain begins to suffer. Studies have shown that long-term use of medications containing diphenhydramine is linked to a higher risk of dementia. One large study published in JAMA Internal Medicine looked at over 3,400 seniors and found that people who took anticholinergic medications for longer than 3 years had a significantly higher risk of developing dementia, even if they had stopped taking the medication before the symptoms showed up. This tells us that the damage may not be immediately noticeable, but it can be long-lasting. Another problem is that people assume these drugs are harmless because they're available without a prescription. But just because something is sold over the counter doesn't mean it's safe for long-term use, especially for older adults. Many seniors take these medications daily without realizing they could be hurting their memory and focus. And since the effects build slowly, it's easy to miss the warning signs. Maybe someone starts forgetting names more often or feels a little foggy in the morning. They may think it's just part of aging when in fact, it could be the sleep aid they're relying on each night. These medications can also cause grogginess, dizziness, and confusion during the day, especially in the morning. This can lead to falls, car accidents, and trouble managing daily tasks. Older adults are especially sensitive to these side effects because their bodies process drugs more slowly, and the effects can linger much longer than intended. In some cases, the sedation can last into the following day, making it harder to stay active or alert. It's important to understand that while sleep is crucial to good health, how you get that sleep matters. Using medications that quietly damage the brain is not a safe solution. There are safer ways to improve sleep without sacrificing brain health. Some options include creating a regular bedtime routine, limiting caffeine and screen time in the evening, keeping the bedroom dark and cool, and getting some daylight exposure each morning to help regulate the sleep-wake cycle. Gentle activities like stretching or listening to calming music before bed can also help the body relax. For people who still have trouble sleeping, there are non-drug treatments like cognitive behavioral therapy for insomnia, which has been shown to be more effective in the long term than sleep medications and without harmful side effects. If you or someone you care for is using sleep aids regularly, it's worth taking a close look at the ingredients. If diphenhydramine or any strong antihistamine is listed, consider speaking to a doctor about safer alternatives. The brain is one of our most valuable assets. Protecting it means being aware of what we put into our bodies, even when the problem seems as small as a restless night. Sleep is essential, but the cost of memory loss is too high a price to pay. Seniors deserve better options and better information, and that begins with understanding the hidden risks behind common nighttime remedies. Opioids, pain relief with a cognitive cost. Opioids are a group of medications often prescribed to manage moderate to severe pain. These include drugs like morphine, oxycodone, hydrocodone, and fentanyl. For seniors dealing with chronic conditions such as arthritis, back problems, or recovering from surgery, opioids can seem like a lifeline. They work by changing how the brain responds to pain signals, which can bring fast relief. But what many people don't realize is that these same medications can also change the brain in ways that are harmful, especially when taken over a long period. While they may ease physical pain, they can quietly damage memory, thinking, and attention. Seniors are particularly at risk because their brains are more sensitive to the effects, and the drugs tend to stay in the system longer due to slower metabolism. Research has shown a clear link between long-term opioid use and problems with memory and thinking. A study published in the Journal of the American Geriatric Society found that older adults using opioids were significantly more likely to experience cognitive decline, especially in areas like attention and memory. Another study from the University of Washington tracked over 10,000 veterans and found that those on long-term opioid therapy had a 22% higher risk of developing dementia compared to those not using opioids. What makes opioids so dangerous in this way is that they reduce activity in the brain's frontal lobe, the area responsible for decision-making, problem-solving, and memory. Over time, this slowing down of brain function can make everyday tasks harder, reduce independence, and increase the chances of developing dementia. In addition to harming brain health, opioids also come with a high risk of dependence. This means that over time, the body gets used to the drug and needs more of it to feel the same effects. This cycle of tolerance and increased use raises the risk of side effects and makes it harder to stop. Withdrawal can be uncomfortable and even dangerous, which keeps many seniors on these drugs longer than intended. On top of that, opioids can cause other problems like constipation, fatigue, dizziness, and falls, all of which can further reduce quality of life in older adults. Falls, in particular, are a serious concern, as they often lead to broken bones and long hospital stays, which can also contribute to mental decline. Despite the risks, opioids are still commonly prescribed to older adults, sometimes without proper monitoring. In many cases, they are given for conditions that could be managed with less risky alternatives. For example, physical therapy, acupuncture, massage, or even certain types of exercise have been shown to reduce chronic pain without the side effects of opioids. Non-opioid medications like acetaminophen or topical creams may also be effective, especially for localized pain. What matters most is having a conversation with your doctor about the real benefits and risks. If you've been on an opioid for more than a few weeks, it's worth reviewing whether it's still necessary and if there might be safer options available. It's also important to avoid mixing opioids with other medications that affect the brain, such as benzodiazepines or sleep aids. This combination greatly increases the risk of confusion, memory problems, and even overdose. Always make sure your healthcare provider knows everything you're taking, including over-the-counter drugs and supplements. Keeping a detailed list and bringing it to your appointments can help prevent dangerous drug interactions and give your doctor the information they need to make safe choices for your treatment plan. Protecting your brain means thinking ahead. While pain management is important, it should never come at the cost of your memory or mental clarity. If you or someone you love is taking opioids, especially for long-term pain, take the time to learn about the risks and explore other options. A good night's sleep, a walk in the sun, or a stretching routine might not offer instant relief, but they come without the long-term cost of cognitive decline. Your brain deserves that protection. What you can do: safer alternatives and protecting brain health. Now that we've talked about the 5 medications linked to memory loss and dementia, it's time to focus on solutions. While some of these medications may be necessary in certain situations, there are often safer options available that can protect your brain without putting your health at risk. The first and most important step is awareness. Knowing which drugs can hurt your brain gives you the power to make informed decisions. The next step is to talk with your doctor. Schedule a review of all your medications, including anything you take over the counter. Many people forget to mention things like sleep aids, allergy pills, or pain relievers, but those can be just as risky as prescriptions. Bring a complete list and ask your doctor specifically if any of them could be affecting your memory, focus, or balance. It's also a good idea to ask if any medications you're taking have anticholinergic effects, even if they're not on the warning label. Sometimes, drugs used for bladder control, nausea, or depression fall into this category without clearly stating it. If your doctor agrees, ask about alternatives. There are many medications today that offer the same benefits without the cognitive risks. For example, newer antidepressants like sertraline or citalopram tend to have fewer effects on memory than older ones like amitriptyline. For sleep, instead of using strong sedatives or antihistamines, you might explore behavioral therapies or gentle natural remedies like melatonin under medical guidance. For anxiety, breathing exercises, meditation, or even talking with a counselor can sometimes bring lasting relief without the risks of benzodiazepines. But medication is just one piece of the puzzle. Lifestyle changes can do more for your brain than most people realize. Regular physical activity, even walking just 30 minutes a day, has been shown to improve memory and reduce the risk of dementia. Exercise helps increase blood flow to the brain, reduces stress, and supports better sleep, all of which are key for staying sharp. Eating a balanced diet also plays a big role. Diets rich in leafy greens, berries, nuts, fish, and whole grains have been linked to better brain function. These foods help reduce inflammation, improve circulation, and protect nerve cells. The MIND diet, which combines the Mediterranean and DASH diets, is especially known for helping lower the risk of Alzheimer's disease. Staying mentally active is another powerful tool. Engaging your brain with reading, puzzles, learning a new skill, or social activities can help build what doctors call cognitive reserve. This means your brain builds stronger connections, which can help protect against memory loss even as you age. Social interaction also supports mental health. Being around friends, family, or a community group can reduce the risk of depression, which is another factor that can affect brain function. If you're isolated, even small steps like joining a local senior center or attending a hobby group can make a big difference. One thing that's often overlooked is sleep. Poor sleep can have a major impact on memory and focus, and many people treat it with medications that end up making things worse. Instead, create a calming bedtime routine. Go to bed and wake up at the same time every day, even on weekends. Keep the bedroom dark and quiet. Avoid screens for at least an hour before bed. These small habits, when done consistently, can lead to better sleep without needing to rely on harmful drugs. Lastly, don't be afraid to speak up. You are your best advocate. If something doesn't feel right, if you're feeling more forgetful, foggy, or tired, it's okay to ask whether your medications might be playing a role. And if a doctor brushes off your concerns, consider getting a second opinion. Your brain is worth protecting, and you deserve to have all the information to make the best choices for your health. Taking control of your brain health doesn't mean stopping all medications. It means being smart about which ones you take, how long you take them, and what other tools you can use to stay well. A combination of safer medication options, Healthy habits and staying informed can go a long way in keeping your memory strong and your mind clear. Aging doesn't have to mean losing your sharpness. With the right knowledge and a few changes, you can protect your brain and enjoy the life you deserve.